Hi, I'm Dr. Priya Matthew from MVP Family Dental, and I'm here to answer some of your questions about dental cavities. Cavities are caused by different dental bacteria that are in your mouth, one of which is called Streptococcus mutans. That's the name of the bacteria. But they sit on your teeth, and then they take sugar and they make it into acid, which actually is what eats away at your tooth and causes a cavity. A dentist would check for cavities when you come in for your checkup, when we use an explorer, which is an instrument with a little bit of a sharp edge, but we're just checking the tooth for any soft areas that we can feel. And we also use our dental x-rays, and we can see interproximal, which means between the teeth, cavities in that manner. And we also use something called Pearl AI, which helps us to distinguish decay a little bit more easily than our human eye can. The stages of a cavity are incipient, where it's somewhat through the enamel, which is the outer layer of your tooth. Then it goes to that junction between your dentin and your enamel, dentin being the inside of the tooth. Once it hits the dentin, you got to watch out, because that thing's going to spread like wildfire. I mean, it spreads, and it can get down to the pulp, which is where your nerve is, and that's when it hurts. So it's important to get to the cavity before it gets to the pulp and hurts. So when people tell me, oh, it doesn't hurt, I say, that's great. We want to stop it now, because when we remove the decay and fill it, it cannot spread. So it's kind of like putting out like a wildfire. If you can stop it with the water, then it won't keep going, right? It's the same idea. So cavities, in my experience, cavities cannot spread from tooth to tooth. It's just the bacteria that's spreading and causing the cavities. It is not possible for cavities to go away unless they are incipient, which means they're not through the enamel. And even at that point, they're not necessarily going to go away, but they can be arrested, like police. No, I'm kidding. But they can be arrested where they are. They can stop where they are. How do you stop a cavity from progressing? By using fluoride rinses and doing your checkups regularly, so we can make sure we see them early on with the checkup x-rays, and also flossing, all the things. Brushing twice a day. Those are, you're getting the food debris out of those little nooks and crannies in your teeth. Cavity filling should last years, if not decades. It depends on how good you are with your home care and coming in to be checked.
So dental cleanings prevent cavities?
Dental cleanings prevent cavities by letting the dentist and dental professionals check your teeth every 6 months to prevent them before they get super large and painful. So we want to stop the cavities before they get to that point. If you suspect you have a cavity, call us at MVP Family Dental at 215-887-7171. We're here to help, and we can let you know if you have a cavity or not.